Oh, because if they're doing that, I would say have them on that side,
That side.
on that side of the podium.
Thank you.
Yeah. Um. Excuse me, that side of the podium? Yep. And then I'll make sure that I get both of you there.
There we go.
Really? Just stand a little bit forward. So, there we go. We're good there. All right. All right, so you are recording.
Hello? Okay.
Well, good morning, everyone. Thank you for being here. My name is Yasmin Castellano, and I work all the way across the Center for Autism and Related Disabilities, and I'm also the chief for the Accessibility and Opportunity Committee from here, from the college, the CBCS. And we are having a presentation today about the importance of hormones in addressing the health disparities of girls and women with autism, which I believe is an amazing, interesting topic to talk about. First of all, it is April, so it is Autism Awareness Month. And second of all, because, as women and hormones, usually it's not something that we talk a lot. And I think to raise awareness about us as females and the impact of hormones in our everyday life is a topic that is very important to start raising awareness, not only among ourselves as women, but also across board for everybody. So a little bit about Olivia. Olivia is my coworker. She also works at the Center for Autism and Related Disabilities, and she is amazing. She said yes when I asked her for this presentation. Well, she was like, well, but she, excuse me, she just took that leap of faith twice, because the first time she presented this at our annual conference, and I was the one like, let's go and do it. And she was like, okay. So twice she has been taking the leap of faith. So I'm very proud of her. She's amazing. She's a great professional, very committed to what she does. Not only as a professional, as a human being. She's extremely kind and cared, and she just loves to give the community and support the community. Amazing co-worker, someone that you can count on. I don't know what else can I say about this amazing woman. Very proud to be her co-worker, and I will pass the microphone to her so she can talk a little bit more about her credentials.
Thank you, Yasmin. Wow, I'm blushing. Let me see if I can put this here. Okay. Can everyone still hear me fairly well? Okay. So yes, as Yasmin said, I work for the Center for Autism and Related Disabilities, also known as CARD or CARD USF. You may have heard of us there. Just a couple of quick disclaimers that I need to make before kind of jumping in. So as a CARD employee, just some information about CARD and our funding. I'd be willing to kind of share the slides for this afterwards, so I can read all the specific figures and percentages if you'd like. So apart from working for CARD, I also have a personal connection to the field. I have a younger brother with autism, and I myself was diagnosed with ADHD at 35 years old, which I feel is almost kind of I'm a little bit of a cliche of in the neurodivergent world of a woman kind of getting on and masking until hormones basically mean that we no longer can, but we'll get into more of that later. But I just do want to take a moment to say thank you for taking the time to attend this talk today and supporting neurodiverse people. So a little bit about our objectives today. So we'll go through some of the key ways hormones impact our mental and physical health, as well as I hope to give you a better understanding of the health disparities experienced by girls and women with autism. We also are going to cover some of the first steps that autistic women, caregivers of autistic girls, and the professionals who work with them can take to minimize some of these disparities, and as well as learn about recommendations for, larger systemic level changes. As well as just a quick trigger warning. The presentation will briefly mention topics of suicide, self-injurious behavior, and sexual assault and exploitation. So if that is not something that you can handle at the moment, I understand, and go ahead and you can go ahead and step out. Okay. So with all that said, let me first start with some historical and biological context to this issue. So historically, women were excluded from medical research, or if they were involved, it was often through exploitation. The conventional view in medicine for a really long time was that men's bodies were seen as normal and that women's were atypical. However, there was one medical scandal in particular that further delayed the voluntary involvement of women in research, and that was with a drug called thalidomide. It was a drug used in the late 1950s to early 1960s in Europe and Australia for treating nausea during pregnancy, which led to congenital abnormalities. So as a reaction to all of this, the FDA created a guideline in 1977 to exclude female participants of, quote, reproductive potential from participating in early phase clinical research, except for life-threatening conditions. And although they put this additional stipulation in, it basically created this like blanket effect of just women weren't involved in clinical trials. It wasn't until the National Institutes of Health Revitalization Act of 1993 that the inclusion of women in federally supported phase 3 clinical trials became required. So with more women participating in research, we have discovered that there are differences in between the sexes, and not just how some diseases and conditions present, but also in how our bodies react to their treatment. So in 2001, the Institute of Medicine published a report, Exploring the Biological Contributions to Human Health, Does Sex Matter? And the committee that was in charge of that report, they concluded that differences from the cellular to the organismal and behavioral levels do exist. They are important, and that sex should be an important variable in research. So again, the differences exist when you're just looking at cells, when you're looking at organs, and also in how we express our behaviors. And there are many examples of the differences that we have learned about. For example, some of you may have heard that kind of more research about how heart attack symptoms can differ for men and women. So oftentimes women may not have the traditional symptoms of that a heart attack may be coming. So they may instead have jaw, neck, or back pain. They may experience nausea and indigestion, extreme fatigue, or fainting. And so obviously, knowing this type of information can save millions of lives. In addition, in 2020, research from UC Berkeley and the University of Chicago, they looked at studies of 86 different FDA-approved drugs. So, and this included things like pain relievers, antidepressants, anti-seizure, cardiovascular drugs. And they found evidence of a drug dose gender gap. So basically meaning if a female participant was given the same drug dose as a male participant, the female participant had a higher drug concentration in her blood, and it took much more time for the drug to be eliminated. They also reported that women experienced worse side effects in more than 90% of cases, and nearly double the frequency of adverse drug reactions compared to men. So the researchers stated that this was due to the biological differences of women's bodies being ignored in those clinical trials. And another area of increased understanding as a result of all these changes is we're gaining a better understanding of the significance of hormones. So we'll go ahead and talk more about that. So first of all, what exactly is a hormone? Hormones are chemicals that carry messages via blood to your organs, muscles, skin, and other tissues to coordinate different functions in the body. So a chain reaction of several different hormones is often involved with these bodily processes. And there are over 50 different hormones that have been identified so far. They work similar to kind of a lock and key system. So a hormone has to fit, I see here, like a hormone has to fit exactly in the receptor site on the cell wall for it to work and for it to be able to deliver the message and then prompting an action in the cell. Most of the tissues that create and release hormones are part of your endocrine system. So these include things like your ovaries, thyroid and pituitary gland, and adipose tissue or body fat. However, we have relatively recently learned that there are many other parts of the body that release hormones and have hormone receptors, such as bones, heart, and your digestive tract. So in this image, for example, this specifically shows the many sites of androgen receptor expression. And androgens are a group of sex hormones, with testosterone being the most common one. So hormones control many different and essential processes in your body. So obviously, you know, we think about sexual function and reproduction, as well as growth and development. But hormones also control metabolism, your immune system regulation, your heart function and blood pressure, bone and muscle health, your appetite and body weight, as well as your sleep-wake cycle, attention, learning, and memory, stress responses, and mood. So some of you who are maybe fairly familiar with autistic individuals may notice, especially those last four are some of the common areas where we do hear some health complaints from autistic individuals. Also, we'll go back to this point in a little more detail later. And so I do also want to talk about, you know, how these hormone levels in females change across the lifespan. So, and we'll just use estrogen and progesterone, as those are some of the kind of most common ones we hear and talk about. So you can see here that there is kind of a bit of a slow, gradual rise early in childhood. And then obviously around the time of puberty, there is this increase in these hormones until they kind of relatively kind of plateau. However, for those of us who do have a period or have had a period, we know that that's not a nice even plateau every single month, that we do have like kind of a menstrual cycle. And so again, on a month-to-month basis, you have these great peaks in fluctuations in our hormones. If a woman is pregnant, there's even more dramatic hormonal fluctuations and decrease as well towards the end of pregnancy there and postpartum. And then once we get to menopause, there's just a very sharp decline in the hormone levels. I also do like with estrogen that it's like a nice dramatic flourish there at the end as it's going as it's going down. So, you know, again, with the hormones, it doesn't even like the smallest fluctuation will end up having a side effect in your body. You know, we often hear the possibility of postpartum depression or executive function struggles with menopause. With estrogen specifically, you know, even though it's mostly known as a sex hormone, but it's also active in the brain, aiding in that attention, memory, and mood stabilization. Plus, it helps the body produce and maintain levels of dopamine. This is, again, with the population of autism or just neurodivergent people with who are have ADHD as well. That is an important chemical for them. Okay, so with all this context in mind, let's talk about the health challenges and disparities. So the CDC current data estimates that autism is about 3.4 times more common among 8-year-old boys than girls. And you might be asking, like, why 8 years old? So the way that the CDC kind of monitors and reports this is through their ATOM network. So they have sites across the United States looking from school records, medical records, about looking for that diagnosis of autism. And why the 8-year-old marker is chosen is that by that age, they feel that most children have been that have autism will have been identified by that point. However, we know that figure isn't completely accurate since there are delays in girls being diagnosed. So there are differing presentations of autism in girls compared to autistic boys. There can also have issues with the assessment tools where they, especially with the data that was used to validate and create them, was kind of biased more to male population. There could also be in cases where there have a girl does have additional co-occurring conditions like anxiety or ADHD. Research shows that that does typically further delay the age of diagnosis. And again, that might be due to a bias of screening of diagnostic tools. It could also be lack of knowledge by diagnosticians about presentation or how to kind of identify when there might be multiple occurring conditions at the same time. With ADHD in particular, it's only been a little over a decade. So basically since 2013 that having a diagnosis of autism and ADHD was even possible. You may have also kind of colloquially heard it as like ADHD. And so there's probably a lot of women and girls who possibly could meet the diagnostic criteria for both, but officially only have one diagnosis. And then we often see too that girls tend to be a little bit better at masking their autistic traits. However, it's also common to see that emotional dysregulation intensifies with puberty. And so sometimes that at that point is when the masking may no longer work. And so that is when, the adults in their lives are like, okay, let's maybe see about an evaluation. I did want to kind of look for the most recent large scale study. The CDC data normally comes out every 2 years. So this was a study from August of 2025 from Epic Research. They looked at 338,415 patients who received their first autism diagnosis between 2015 and 2024. And so you can kind of see here that the age that boys were being diagnosed is younger than girls. But over that 10-year period, the median age for the male patients went from the median being 7 years old in 2015 to about 5 years old in 2024. And you can kind of see that the median age for female patients basically has remained exactly the same at 8 years old. And when you kind of look at some of this distribution in a little bit greater detail, you can see that nearly 1 in 4 female patients with autism were being diagnosed as adults, or in this how they defined that 19 or older, which is more than double the adult diagnoses among male compared to males at about 12%. So more than half of both males and females were diagnosed after age 5. And that kind of lets us know a couple things, that, a lot of kids are being diagnosed too late, and especially too late to benefit from maybe early intervention programs or early interventions. I know some of the great programs that we kind of work and collaborate here in our department. And so we just kind of an overall takeaway, we need to continue our work to make sure that identification improves, but girls are disproportionately getting diagnosed too late. So I did most of the research on autistic girls and women's health has focused more on their mental health, but this was a review of existing research I was able to find when it comes to physical health. So in comparison with autistic boys and men, autistic girls and women have increased odds of experiencing deafness, blindness, and physical disability, allergy, immunologic conditions, infections, musculoskeletal and neurologic conditions, bowel disorders or gastrointestinal problems, rates of epilepsy, neurological anomalies. And then when sometimes it could be, okay, well, that's just because it's, males versus females. But what was interesting is they also looked at the comparison with neurotypical girls and women. And even within the same sex, the autistic girls and women have increased odds for the epilepsy, thyroid diseases, the irregular menstrual cycles, unusual painful periods, polycystic ovaries syndrome or PCOS, ovarian cancer, as well as preeclampsia, preterm birth, and also increased odds of receiving an elective cesarean delivery. And we'll go into a little bit more of this in a minute. So there has been some research during these periods of looking at these periods of great hormonal shifts. There's often, compared to neurotypical peers, there's often issues with their menstrual cycle. So again, the irregular cycles, the PCOS. as well as dysmenorrhea or painful menstrual cramps, menorrhagia or heavy menstrual bleeding. And this is not just like, oh, it's a little heavy. This is excessive, heavy, or prolonged menstrual bleeding lasting over 7 days. And some of the studies have also found more reports of premenstrual syndrome or PMS and premenstrual dysphoric disorder or PMDD. But that is not consistent necessarily across studies. The one thing that kind of seems to be appearing in the literature over and over is these experiences of having heightened sensory issues. So not only heightening of existing sensory issues, but new sensory challenges emerging in puberty due to the hormones being triggered with puberty. So some other possible struggles are with emotion regulation, behavior, and executive functioning. Again, due to the hormones. This can be a really distressing and overwhelming time, and research consistently shows struggles with depression and anxiety. And due to struggles with social skills and naivety, it can also place these girls at risk for sexual assault, especially if they struggle with compulsive or risk-taking behavior if comorbid with ADHD. So I'm not a woman with autism or a girl with autism. So I did want to make sure that they have a chance to have their voices heard during this presentation. So I just wanted to share just some anecdotes. So I was panicking and screaming and saying to my mom, like, I'm bleeding. I don't know what's going on. I felt like I had to hide every negative emotion, my anger, frustration, and feeling like I would burst into tears at any moment. In this study, a participant named IV recalled making myself too sick so that I didn't have to go into school. That was a result of anxiety, and that was partially due to my hormones and not fitting in. And then another participant, Anne, recalled about her first relationship that it was, quote, very, very bad, very full of red flags. I was just very naive to that. So when we're looking at pregnancy, birth, and the postpartum period, again, the research is showing that hormones appear to heighten sensory issues. And there are some common situations that can be a kind of sensory triggers. So doctor visits, the smells in different in a clinical setting, the fluorescent lights, maybe all the sounds of beeping. Those are kind of fairly typical for a medical environment, but there's also additional things of maybe like discomfort from instruments or examinations that are fairly typically standard as part of like prenatal care or other obstetric care. Breastfeeding is another common thing. The thing that is being reported by autistic women is being very overwhelming from a sensory point of view. And then birth, which if anyone has given birth, that's not all too surprising. That's a very overwhelming experience for a neurotypical person. But if you also are experiencing sensory issues, you can and maybe struggles also with executive functioning, you can understand how that could even be a more heightened of an experience. Mental health. There are also mental health challenges during pregnancy and postpartum. 40% of autistic women experience depression during pregnancy or prenatal depression, and 60% of autistic women experience postpartum depression. There could also possibly have possibility of psychosis or other serious mental health experiences during this period that would require treatment. So autistic women are also reporting in research that there are kind of common patterns of frustration with care being provided and gaps in needs and their needs being met. So one is communication challenges, but it's kind of both ends of the care relationship. So not only kind of challenges in understanding their providers, their care providers, healthcare providers, but also challenges in feeling like they can communicate what they're experiencing, asking questions. They often report like a fear of disclosing that they even have autism. And they also have report like feeling like either they're kind of inundated with information or have kind of too little information, especially too little information about maybe some of the pregnancy experiences they're having, like say with like the sensory issues that maybe a neurotypical patient might not have. And what can they realistically do about that? Postpartum, they are also more likely than their neurotypical peers to find it isolating and unable to ask for help and support and to have their parenting judged. They also are at increased risk of experiencing adverse birth outcomes, such as preeclampsia or preterm birth. And, I think we sometimes think with some of these experiences during pregnancy or birth of like, okay, well, it's unfortunate that they're experiencing this, but it's only happening for a limited time period. However, that's not the actual reality of it. There is the mental memory and the impact on mental health from experiencing this, but there's also research showing that from a physical level, this is also something that needs to be taken seriously. So there's a recent article that found that women who experience hypertensive disorders during pregnancy, which include things like preeclampsia and high blood pressure, are at increased risk for nearly every cardiovascular health condition, including chronic high blood pressure, coronary artery disease, heart failure, and stroke. And then women diagnosed with gestational diabetes are about 10 times more likely to be diagnosed with type 2 diabetes compared to women who don't have this obstetric history. And that in itself is linked to heart disease, stroke, and dementia. So, we need to be thinking about these things, not just while a woman is pregnant, but also in terms of monitoring her health many years from now. Again, I did want to share some firsthand accounts. So this is from Ellen, this is one of the mothers in this study. So she reported that the bright lights and the noise, I don't take drugs, but I imagine when people talk about living like having a really out of control trip, this is what they would experience. I was used to minimizing things when I described them, but I needed to accurately describe it because I really needed advice, but conveying how things actually were, I found it really difficult. And then another mother reported, the sensation of baby's body against mine is wonderful and very calming, but I struggle with little hands touching my skin. So I wear nursing tops that cover most of my skin now. So again, that last account shows that while these sensory issues exist, there can be some solutions that could be figured out. So struggles during menopause. We have an inside we have an inside joke at CARD, given the age of us and being mostly women, that we should be having a jar in the office for how many times we've mentioned the word menopause in a day. There we go. My imaginary quarter. So in comparison with neurotypical women, autistic women experience higher psychological complaints, so things like anxiety, low mood, fatigue, as well as somatic complaints during menopause, and just more complaints overall. What the research is finding is that during menopause is kind of seeming to exacerbate existing autistic traits, and as well as bringing some new issues. So again, the heightening of sensory issues, declining of executive functioning, their inability to mask, increased depression and anxiety, and suicidal ideation. So some of these symptoms, they're experienced by neurotypical women as well. There is kind of that increased risk for depression, anxiety, struggles with executive functioning. However, it's really, from what research is kind of finding, is that it's kind of that base experience of menopause plus the intense experience of autism. And so, for example, with the suicidal ideation, autistic women experience suicidality at 3 times the rate of non-autistic women during this period. So you can kind of just see that, yes, some of these things are not unsurprising for menopause, but they're having a larger impact. And then a lot of the autistic women in the research are reporting kind of a lack of knowledge by healthcare professionals on autism and menopause, and just kind of what they perceive as a lack of interest by their providers in knowing more. And they're having real challenges in trying to find resources or just practical advice for their unique menopausal challenges, especially the sensory issues. So this is, again, some quotes from the women in these studies. I think our society doesn't talk about, address, understand women in our age in general very well. And so when you have the added dimension of autism, there's no resource, there's no font of wisdom to tell me how to handle that. And there's no room in society for it either, because we don't talk about menopause, let alone autistic menopause. Not knowing you're autistic in the first place, and then suddenly experiencing unprecedented phenomena which don't correlate with regular menopause. So you don't know if it's menopause or not. And so you wonder whether you're going nuts or have some disease or what. And then just to kind of give paint a picture of what some of these sensory struggles can look like. During menopause, I was on 3 meltdowns per week at a time. My meltdowns were of the nature that people would call, quote, a basket case. And she would strip down to her underwear, sometimes during a meltdown at work. So let's not, I don't want it to just kind of paint like this kind of, if you only kind of focus on kind of what the reality is, let's kind of also look at what are some future steps we can all be taking. So first of all, nothing about us without us. So if you guys aren't kind of familiar with this concept, it's just basically that in the disability community, it's kind of the idea of the importance of involving, or just the advocacy communities, involving the population when you're coming up with future steps. So this was an amazing article. I highly recommend you guys to go read it. That was asked autistic girls and women kind of what were what they would identify as health-related priorities, research priorities. So I'm just going to share a selection of the health-related priorities that they identified in the article. So one was more research focused on, quote, how we can make life easier. I spent years struggling in school until I mentally broke. I think this is an issue that needs to be addressed. Why does it take so long to help autistic females? Why do we have to be mentally exhausted? They also felt there should be more research addressing barriers in healthcare. And quote, understanding the presentation of autism in girls, women, and gender diverse people to ensure that the GP, the general physician, is going to know about autism in women and not just think that it's a thing for little boys with behavioral problems. They also recommended having more research, understanding, and supporting and more research, understanding, and supporting the physical health needs of autistic girls and women. A better understanding of their experiences of aging and, quote, how as I age, my body is going to change and I don't know what's going to happen because there is no long-term research. Research also needs to focus on specific experiences of physical health, such as having different presentations in my diseases that the textbooks maybe not agree with, as well as the impacts of having multiple chronic health conditions. It is also critical to understand the healthcare experiences of autistic people with high support needs who have been denied medical and mental health care because of their level of autism. They also stress the importance of co-designing research and supports with autistic people. Research needs to be informed by the perspective of all autistic people, including non-speaking autistic people with intellectual disability, and autistic women with very high support needs. Okay. So, kind of, again, from kind of my, what kind of our experience in the field and kind of from research, what we're seeing is kind of some takeaway research priorities. There just needs to be more research focused on women in general. But again, on this particular group. If anyone wants to guess, what was the year that the first study on autism and menopause came out? What would you say? It was 2020. Yeah, close. Yeah, no research done on this topic until 2020. No, there was no pre-menopausal or menopausal autistic women. So, so obviously we need to involve girls and women with autism when identifying research priorities, including those who are nonverbal, have an intellectual disability, or, quote, other high support needs, as they mentioned in that research article. We are also finding that autistic girls are falling through the cracks. So we need better measures to prevent this from happening. You can't be aware of having any of these additional health risks if you don't even know you have autism in the first place, right? There also needs to have, something I think that should be done is there should also be more research looking at autism symptomatology and hormone activities. There's something being done with within the field of ADHD that's very interesting. So this is by work being done by Michelle Martel out of the University of Kentucky. But basically what she did with her study is that she followed college students who have a formal ADHD diagnosis across their menstrual cycle. So her team measured participants' hormone levels every day and then assessed their ADHD symptoms with questionnaires and cognitive tests. And what they found is that the participants reported worse ADHD symptoms such as inattention and impulsivity just before and at the start of their period, and to a lesser extent around ovulation. This is kind of aligned with the results of the cognitive tasks, but also what many psychologists and what they were personally finding from their patients as well. So what's being done now is that more and more clinicians are now, when it's like looking at like ADHD medication, for example, they're prescribing it in such a schedule where it's taking this into consideration. And so there may be more medication or less medication depending on where like a woman is in her menstrual cycle. I think it would be very interesting to see if there's something similar for women with autism. There's a lot of overlap also with autism and ADHD. About 40 to 70% of autistic individuals also meet the criteria for ADHD. So this could be a really big benefit for that population too. So many healthcare providers do not feel like they have sufficient education and training to properly meet the needs of their autistic patients. So, we really need to work with helping provide them more training on identification and diagnosis, understanding mental health, especially with the primary care, and understanding mental health and how that can maybe look, especially if there are multiple neurodivergences. I kind of joke oftentimes that if you're neurodivergent, it's often like a BOGO situation. You don't just have one diagnosis, you have maybe another or a couple. So that, again, it could be a huge area of we can make a lot of improvements with. So autistic women report having unmet healthcare needs, but especially when it comes to reproductive and sexual health. So this should also be another big area of focus. And then, again, pharmaceutical considerations. So not only maybe possibly with their medication as it relates to their menstrual cycle, like the example I kind of gave with the research from the University of Kentucky, but females with autism are more likely to be taking multiple drugs and supplements. So you need to really be thoughtful of that and exactly on what drugs or supplements, when, and how much is being given. Also kind of maybe balancing out different health needs, like maybe we know that depending on the type of birth control and how much is being given, that could maybe have impact on bone strength later on. That might be an issue if the person also has connective issues, which is, again, common for people with autism. So just kind of thinking about things in a more holistic fashion in general. And then just as part of, just our annual well visits, just having routine monitoring of our hormonal health as well. Some other recommendations for healthcare providers, just making sure that they're kind of aiming to make, things are explained in a way that's easy to understand. Using visuals, illustrating information in a visual way would be very beneficial for not only a lot of their autistic patients, but other patients, say if they have English as a second language or other neurodivergencies, that could be very helpful. Allowing time for a processing delay when communicating with their patients. And then another big one that's being asked by autistic patients in the literature is just better accommodation of their sensory needs. So not only just asking about, I mean, first step would just be asking, acknowledging it, but also making those accommodations. And it doesn't have to be a huge thing. It could be just like turning off a light or dimming the lights. I put a picture here of this light filter. It can just kind of has magnets on the end and just attaches over fluorescent lights. It could use communication boards, or you could even offer maybe the appointment in telehealth if that's possible, so that they can be in a sensory environment that's comfortable for them during the appointment. For school personnel and therapy providers, they also need to have education on how autism presents differently in girls, so they can support that early identification efforts, being aware of the signs of masking, again, because that's such a common struggle for, especially with girls. And then the other thing is to consider hormones as a factor when collecting data and creating intervention plans. So is a student's behavior changing or presenting differently in relation to their menstrual cycle, for example? So just having that in mind. Again, the increase in hormones can start as like young as 8. So it's not just looking at students who are teens. It might be also the preteens. And just making sure that accommodations are being made for those hormones and those hormone fluctuations. For parents and caregivers, they of course also need to know about autism and the signs of masking. I think sometimes with parents, it can be hard too, because they feel like, oh, well, my daughter seems fine, but just because their child may seem fine doesn't mean they actually are. So just, again, having that information, as well as just having that information of the increased health risks, so they can be proactive in, when they're making health decisions for their child, and then they can educate their loved one with autism about the risks too. We need to educate girls about their health beyond just puberty. They need to know how their hormones will change their health across their lives, and what we know so far about the impact of autism on those stages. I think there's, understandably a lot of concern by parents of like, okay, I need to teach them like self-advocacy skills. There's that need of like, I want them to be independent, but health advocacy is part of that journey for independence. That's a huge, it's one of the main questions when, somebody is getting close to 18, and if like whether they need any additional legal supports when they become an adult. It's like one of the main questions we ask oftentimes is like, can they make a healthcare decision? Do they have that information? Can they understand that? So that's an important skill that parents can help their child work on. And then just finally at the end, I did want to share recommendations by autistic women for autistic women and girls. So what they have said is, 1, lead as healthy of a lifestyle as you can, to help support good physical and mental health. Ideally, you'd want to prevent or minimize the negative impact of some of these health challenges, being aware of these increased risks so you can be proactive. Another huge recommendation by them was to keep a record or use an app to track your symptoms relative to your menstrual cycle or other hormonal changes, recording, what your sensory experiences are, your mood, medication effectiveness. This will make it easier to identify patterns, and then you can share the information with your healthcare provider to make treatments more effective and tailored to your needs. This next one I know is a lot easier said than done, but speak up about your experience. We gave the example of that study on menopause in 2020, like that only, started, and that snowball effect of what we now know, that was because, there were there were women who were willing to speak up and share about their experience. And this doesn't mean like you have to go out and start a YouTube channel or anything like that. Although if you do, more power to you. But it's, if you're at your appointment, if you're speaking with the people in your lives to, share what the reality is. Another big one is to find community. That's oftentimes with those like practical solutions of like, which nursing shirt should I get so that I'm not having a sensory overload, or which provider could be helpful. That oftentimes can come from, getting in touch with other people in the community. Making sure that your sensory needs that you're taking those seriously, so you can prevent the sensory overload. There's different techniques like having a sensory diet or working with an occupational therapist. And if you have questions about that, that's something we can help with at CARD. And then another area we can help as well is kind of if you're trying to find mental health therapy that's adapted for neurodivergence. There are also, it's very important to have somebody who kind of understands that how these experiences will look and be expressed differently. And we do know a number of providers who they themselves are neurodivergent, so could help facilitate that, getting connected with them too. So with that, I do want to go ahead and just say thank you for attending. I did want to give a small favor, as our colleague Lourdes says, and if you could please just complete this brief evaluation, just 6 quick questions. But it does allow us to kind of take the time to come and present and do these kind of presentations for you. And with that, I did want to just kind of open it up for questions or comments. Go ahead. So it's not so much that the hormone, are you asking like, how do we know it's, that like an imbalance in hormones is causing, okay. So this is still like a lot of this research is still needing to have more attention, more focus, and again, just more studies. But there is, there is a bigger body of evidence, I would say, as far as the role of hormones and executive functioning, and the sensory piece specifically is a little bit trickier, as a lot of that is more, it's a little bit harder to put yourself directly in the shoes of the person experiencing those sensory issues, but it is incredibly consistent across different studies, depending on different ages, that there does seem to be a clear link between hormones, fluctuations in hormones, and different sensory experiences being kind of different from what's typical for that individual. Mm-hmm. Good. Yeah. So yeah, it's so there, and I guess it's kind of like for just kind of anybody, right? With like, again, like I guess I'll take the example of menopause, of like women oftentimes are struggling with executive functioning issues during premenopause. But they're still doing their everyday things. It's more difficult, more challenging. And there might be kind of secondary effects to their health from that and their relationships and things like that from the experience, right? And again, it just seems from what's been seen in the research so far is that it seems to be a greater challenge for autistic women or girls to kind of overcome because they're already having kind of those challenges from their autism, and then they're having these increased things from the hormones. Yeah. But yeah, it doesn't mean that they're not still living their lives and doing the best that they can with, obviously. So. Any other questions?
So if there's no more questions, I really appreciate for you guys attending. Thank you for the questions. It has been recorded, so I will, excuse me. So we'll send the link for the recording to the college. And basically the idea behind it is, again, to raise awareness, to educate ourselves, and hopefully to provide some strategies to be able to support and accommodate not only our coworkers that probably are going through these hormone changes, to all probably has autism, probably they have never been diagnosed and they're trying to, to function. But also the students, if you're dealing with the students as well, just to be aware and a little bit more mindful that probably the student is going through some physical challenges, or probably that student is neurodiverse, and probably that even the student doesn't know that is going through it. So, but maybe we can see those red flags and probably provide some support or guidance for that person or that student, or probably for ourselves, as women as well, as of, to be more aware of our own health and the impact that our health has on our everyday task that we are doing, and probably have a little bit more self-compassion and self-care, and also advocate and educate the world about what we go through. So thank you so much for being here. And if you have any other questions later on, you can email me or oh my gosh, talking about hormones and menopause. Olivia, forgot her name. This is what happens when you're going through menopause and executive functioning, and a plain example of what she's been talking about. We can email Olivia, and she will be more than happy to answer any other questions that you might have. Okay. Well, thank you. Enjoy your day.
Thank you.